Hi, I'm Dr. Art Mollen. Welcome to Feeling Good. Did you know that a cup of coffee a day keeps the doctor away? Well, according to recent studies, there are numerous health benefits to drinking coffee. Researchers, in fact, found that it's the #1 source of antioxidants in the American diet. In fact, 1 or 2 cups of coffee a day appears to be beneficial because caffeine may actually help to control movement if you're suffering from Parkinson's. Drinking coffee can also lower the incidence of cirrhosis by about 22% in drinkers. Researchers have also concluded that drinking coffee, again in moderation, can protect against heart failure. And do you have a tattoo and you're thinking of having it removed? Well, there are 3 basic ways to remove it. It can be cut away, rubbed away through dermabrasion, or removed with lasers. Although the lasers break down tattoo pigments, it could leave you with an allergic reaction, and some inks are much harder to remove than others. So if you get a tattoo, just consider it to be a permanent tattoo. And H.I.V, it's the virus that causes AIDS. It's spread through sharing blood or bodily fluids with an infected person, such as through unprotected sex or dirty needles. There's still no cure or vaccine, but early treatment with an anti-HIV medication can help the immune system to fight the HIV virus. It may not cause any symptoms at first, even for years. The only way to find out if you have the virus is with blood tests, which look for antibodies to the HIV. If you get a positive result, you may need to have a second test to confirm the results. Although you may test negative, even if you're infected, you may still need to repeat the test in several months or even several years. Now, everyone should get tested at least once, particularly if you're between the ages of 13 to 64. And now, real men, real talk. You know, heavy drinking, it rocks the central nervous system. It leads to headaches, dizziness, nausea. The morning after price, that includes a pounding headache, cotton mouth, a queasy stomach. And in fact, you don't have to get wasted to pay the price the next morning. In fact, just a couple of drinks can trigger that headache and hangover symptoms. Red wine contains tannins. These are compounds known to trigger headaches in certain people. Malt liquors like whiskey also tend to cause more severe hangovers. Now, the gentlest choices are clear liquids, vodka and gin. And eating at bedtime, well, if you're already drunk, there's no help to that. Food has to be in your stomach before that happy hour to have any benefit at all. Also, alcohol doesn't help you to sleep. It's just the opposite. So a nightcap, forget about it. It's going to disrupt the quality of your sleep, according to British researchers. And the artichoke extract, it's been found not to help the hangover at all. Doesn't seem to work, so forget that. But the prickly pear cactus can reduce the nausea and the dry mouth if you get a hangover, but not the dreaded headache. The only proven cure? Tincture of thyme. Try that and try not drinking. And STDs. You don't have to have sex to get an STD. Skin-to-skin contact is enough to spread the HPV, human papillomavirus. That's the one that causes genital warts. Vaccines can protect against some of the most dangerous types. Chlamydia, that's a common STD. It can lead to infertility if left untreated. It clears up quickly, however, with antibiotics, but it often goes unnoticed because the symptoms are basically vague in the beginning. And in men, they include burning and itching at the tip of the penis, discharge, and a painful urination. The symptoms in women include vaginal itching, malodorous discharge, and pain during sex, as well as painful urination. Now, most cases of genital herpes are caused by a virus known as HSV2. It's highly contagious and can spread through intercourse or direct contact with a herpes sore. There's no cure, but the antiviral drugs known as Valtrex and acyclovir can reduce the number of outbreaks and the severity. To reduce your odds of getting STDs, ask your partner if he or she has had an STD, ask partners to be tested, and of course, use condoms in order to protect yourself. So there's certain ways you can boost your metabolism if you're trying. Boosting metabolism is the holy grail of Weight Watchers everywhere. But now, how fast can you burn calories? Well, it depends on several factors. Some people inherit a speedy metabolism. If you're one of those lucky people, You can just thank your parents for that. Men tend to burn more calories than women. And for most people, well, metabolism steadily slows, unfortunately, after the age of 40. Our bodies constantly burn calories even when we're doing nothing. This resting metabolic rate is much higher in people who do more aerobic exercise and have better muscle tone. Exercise may not necessarily build your muscles if it's aerobic, but it revs up your metabolism for 6 to 8 hours after a workout. Some ingredients in energy drinks, well, including caffeine, can drive your metabolism. And when you eat a large meal with many hours between your meals, well, your metabolism slows down. So having a small meal or snacks every 3 to 4 hours, well, that'll keep your metabolism cranking. And spicy foods, red or green chili peppers, they contain compounds that can actually kickstart your metabolism into a higher gear. But crash diets that involve less than 1,000 calories a day will slow your metabolism down, so try not to eat less than 1,000 calories. Natural remedies. You know, this is another thing I often get a lot of questions about. Acupressure. It's a non-invasive alternative for pain. Studies suggest that acupressure can help to treat multiple symptoms related to common discomforts and illnesses. For instance, adults who have chronic low back pain, they found after a period of just 4 weeks, they can actually take acupuncture treatments and it reduces their pain better than physical therapy. It's recommended treatment for vertigo, in fact. C-bands, that's another thing that's been used by putting pressure on the wrist that may help to reduce motion sickness, vertigo, nausea, and vomiting. Acupuncture has also been helpful in the treatment of chronic obstructive pulmonary disease, known as COPD. So, if you're looking for an alternative treatment that may help for a lot of different conditions, try acupressure. I'm Dr. Art Mollen. If you'd like to send me an email, ask drartmollen@gmail.com and I'll try to answer it. Hope you're feeling good.